physician, and we're building a set of communications and applications that enable and support that process. And I'll go later. So one of the things that people need to understand is that one of the big problems is, of course, vaccination is coming, and I'm going along with detail. But you should know that 3.6 million kids between 0 and 3 years of age have not gotten all the vaccines that are required by the CDC. And one of the reasons, of course, is because people are concerned about autism. And you should know that my son is autistic, and all my kids have gotten their vaccines because the evidence between the link between vaccines and autism has basically been disproved at this point. So, we're going to talk about who we are, what we do, product examples, and then I was going to do a short on our vaccine. So, the three amigos. So there's myself, and then of course Chuck, my associate, and then Pinoy couldn't be here tonight. He wanted to join us, but he was a little further away. And all of us are industry veterans. We have between us, I hate to say the numbers, let's just say that when healthcare was being given to dinosaurs, Chuck was there. And I have about 20 years. We met at Healthy on WebMD. Pinoy and I have worked together, and Chuck have worked together. Probably it's our second startup together. And Chuck and I have been through three startups, not including this one.
So what were the other startups that you guys did?
So the three startups that we were involved in previously is a company called CrossApps. It's a web-based practice management system. Let me just click this. Okay. So the three of us went through three startups. Chuck and I started a company called CrossApps. It was a web-based practice management system for doctors. It was sort of a Salesforce for doctors, essentially, is the way to think of it. Where it was back in 2000, which was actually fairly early in that sort of mentality. It was one of the I wouldn't say the earliest, but a very early ASP for physicians to manage their processes, scheduling, billing, charge capture. We were going to build an EMR, and then we ran that business for about 4 years. We learned a couple things. One of them is selling to physicians is a very tough, brutal, ugly process with a difficult return. I mean, you have to have a lot of capital to survive the adoption curve, basically. Running on a minute? Okay. So the second one was a company called Curbside MD. It was a social networking site for doctors designed specifically to enable doctors to communicate with each other securely. And it sort of was a Facebook, secure IM, secure email, and a Yahoo groups where doctors could communicate about doctors, about patients specifically. And we worked with county medical societies in California to aggregate and roll up these docs and get them adopted. And that's a long story as to why that didn't happen. It was one of those board discussions that we don't need to go into right now. Okay?
Thank you.
And then our current startup, of course, as Taylor said. And there's actually a very strong theme as we sort of talk about this thing, because we still always have this vision of transformative internet technologies applied to healthcare at what we call point problems, where there is communication or there's information flow that has to happen between two parties that wouldn't normally communicate clearly with each other. So in this example, what this current startup is, we want to live at the intersection of the healthcare consumer and the medical provider. Find a set of technologies and then a set of applications that can lay over those technologies supporting secure and efficient communication between the healthcare consumer and the physician. So typically today, the most interaction between the consumer and the physician is through telephone. How many of you here are in Kaiser? Do we have Kaiser? Does anybody here communicate with their doctor online?
No.
Except Chuck, who's got hands. Nope. So if you start thinking about your interactions with airlines, rental car companies, anybody else, really the exchange we have now is a website interacting with you as a consumer and providing you real-time information as events change. If airplane's late, you get an SMS text. You change your reservation, you get an SMS text or an email. So that doesn't happen in healthcare today. You don't have a place to go with your physician or your hospital or any organization and say, here's what I want to do, here's how I want to do it, and give me some answers. So our goal is to provide elegant solutions to transform the basic interactions. And so what makes us qualified? Well, in some sense, one could say we're stupid, in the sense that we're brave and persistent, but at some level, you have to be creative in these processes or you won't up making change. And we've done it before. Maybe not ramped it all the way to the full point where it's globally available, but we've certainly made penetration into some fairly large organizations, some fairly large number of doctors. So what do? Well, we have a series of applications we're working on right now. The big problem we're working on one of the problems we're working on is the patient payment process. So again, I asked the question of how many of you have gone to the doctor recently and gotten a statement electronically from your physician? A billing statement.
Or a statement of activity, what was happening.
A billing statement. What the charges that you've had occurred at the physician's office. So it turns out that most people don't even know what they owe and why. 20% of the bill is patient-owned typically, so if you look at your typical bill, about 20% of the dollar amount of that bill is out of your pocket. And if you multiply that by the number of visits and the number of docs and so forth, it turns out that patient billing represents $100 billion in revenue in aggregate for physicians in the U.S. wide. And of which about 50% of that money is written off pretty much as bad debt after a huge effort. So the typical process is the doctor bills the insurance company pays the doctor and tells the doctor what the patient owes. They send a paper statement, and then they ask you for your money, expecting a check typically, or if you write on a piece of paper, you put your credit card number in. And then they repeat that over and over again, getting $20 checks basically, until the bill's paid off. And so you can imagine the back office operations that exist behind these positions to just manage small amounts of money on a very sort of manual, repetitive process.
High volume, small dollars.
Yeah, high volume, small dollars. So the idea behind our solution is what we're talking about is sending out a discrete, meaning secure, guaranteed to be sent to the deliverer, electronic statement. Sorry, so then it links back to payment choices, sends a message to the billing department. You can pay now, put yourself on payment. The typical statement outsourcer charges 50 cents. And then there's the calling and tracking that follows on behind it as part of the process. And so we just launched the solution and we're getting ready to roll it out in a couple of customers.
Great.
The second solution, which is still in fairly deep development, is the concept of what we call eligibility in the cloud. So the idea is, well, actually, I'll tell you the problem. The problem first is you're trying to figure out what insurance a patient has. And typically, everybody in this room who's got insurance has a little card on them that tells the physician's office what insurance it's supposed to have. It turns out, though, a lot of times those cards expire, or you haven't updated your insurance data properly. The physician's office has a hard time interpreting exactly who to charge for the insurance. For example, HMO is a good example. In California, you don't bill the United Healthcares for HMO. You bill a local medical group for your HMO billing, and the office has to figure this out. The real problem, though, is actually seniors. Where Medicare, in about 50% of the cases, seniors don't have Medicare. They've chosen to hand their insurance off to an HMO, and they don't know this. It's called Medicare Advantage. When you walk in the office, they all say, I have Medicare. And the way the office discovers it is they try to submit a bill to Medicare, and Medicare rejects the claim, and then tells them that they need to submit the claim to somebody else. So you can imagine, again, that this thing is just absolutely crazy. So 75% of rejected claims are due to incorrect insurance information. The current ways that you have to do the checking is either through a clearinghouse process, which is cumbersome and slow, or you have to do individual website checks with insurance companies, or you have to call the insurance company for confirmation.
All of which are very expensive.